thank you organizers for giving me the invitation and opportunity to present my talk. I've got no financial disclosures for this talk. Well, genetics can be a huge subject in itself, so very difficult to summarize what's happening in 10 minutes, but I will do my best to present you some recent studies which have gone on. Okay, so just a couple of things before we talk of gene therapy. Eyes is a unique organ in itself, and it gives you an opportunity to study the gene therapies very closely for these very reasons. You don't need a huge amount of tissue to transfect. You can monitor your surgical results, you can follow them up, and nature has given you second control of the contralateral eye. However, in spite of all these benefits and the benefits of neuroimaging techniques, which give you like an histological sections, there is yet no licensed ocular gene therapy. And the reasons we know is costly, and it's not that easy as we talk. Okay, so coming to the gene therapies, RP65 is the most common disease, and that's why it's the most commonly studied disorder as well. A bit of the gene, what it does, it's it all trans retinal ester, which is a special enzyme for your retinoid cycle. Okay, it's a biallelic mutations, and there could be a different phenotypic manifestations in this disease. It could present as a Leber's or a retinitis pigmentosa, or even early onset retinal dystrophies. Before we talk about gene therapy, I thought we'll give you just a little line about how these works. The gene that is being used, or the vector that is being used, is called as a Vority gene Neperpavec. It's an adeno-associated virus type, serotype 2, or sometimes serotype 4 is also now being used, and it contains the complementary DNA which is being modified with the Kozak sequence. And it is being controlled by the hybrid chicken, and a promoter is added to it, which is a cytomegalovirus enhancers. After this has been generated, to prevent further loss, then the vector is purified to substantially remove all the empty capsids, and a surfactant is added. Okay, let's look at some of the results. When this paper came out from the Alberts groups in Philadelphia and Iowa, it felt like a revolution in genetic therapies, and everyone was jumping that, wow, we got a treatment. These were the early results, 12 eyes looking at the dose escalation studies, and they did not find any side effects. And most of these patients showed improvement of light sensitivities, navigated abilities, and some visual acuity, even though we are measuring here cone responses against the raw disease. So it was just an early phase trial. Same group carried on, published their phase 2 results, and when they did injected the 11 of the previously 12 eyes in a standard dose, they demonstrated safety, and that they also demonstrated the longevity of the treatment for up to 3 years. And as a part of that, they also did some multifunctional MRIs, which shows the cortical activations of the visual pathways corresponding to these eyes. Then we had the WOW movement, the first ophthalmic genetic randomized controlled trial. Again, it's the same group, same scientists working, and the results were recently published in the Lancets. And they were looking at it was a randomized open label phase 3 trial. People who are aware of it, this was the study design where both the eyes were injected in a ratio of 2:1 was your control group. And the dose was standard as per their phase 2 results, and what they were looking at the endpoints were the MLMT, which is a multiluminance mobility scores, and also the field testing. I'll provide you some of the data from it. So on the top is the multiluminance mobility scores, and you can see, there's a pointer there. Okay, so you can see there's a significant increase in the treated group versus the control group. They did a wide field stimulus testing, which was the very first time, and we see the positive benefits. But what was also important, that we were seeing improvement in the visual acuities at the end of 1 year. This is the intervention group, and we are talking here about 7 letters, approximately 1.5 ETDRS letters. So for me, this was a landmark trial, we all agree with that, but it also laid foundations for some of the future gene therapies. Okay, we know for the first time that we had a predefined criteria how we introduce the vector in the eyes, but most importantly for me, for the first time we have a stratifying treatment groups by age and the baseline visual functions. And also we have a novel measure of visual functions, which I talked about, the MLMT, which is your multiluminance mobility test, and also we had the field testing, which takes away the cone function test. But however, there is still limitations. We don't know all the answers. We don't know what is the optimum time for the treatment, how long the treatment will last, and we all know that the RP has different phenotypic manifestations, and we still need large studies to see where this could be useful, and also whether the gene therapies can alter the natural history of the RP-mediated inherited disorders. Those were not the only people from Philadelphia. There was another French group, Gall and Mayer, who published their phase 2 results as well. This was a dose escalation studies, 2 different groups. Again, similar effects that they noted improvement in the visual acuities and the multifunction MRIs. Okay, so looking at this, these are the treated groups in the blue, and these are the orange groups which were not treated. If you look at the 2-year results, the untreated group continue to lose the visual acuities. Similar, if these patients had nystagmus, the benefit was far larger at the earlier stages, but they still were maintained overall, and a significant loss in the nystagmus group. There are still other Leber heredity trials which are recruiting at the moment. There are 2 trials from the same group. One is a rescue trial and one is the reverse trial, both sponsored by Genset Biologics. Importantly, if you look at it, they are looking at the intravitreal injections, and the first study is looking at the visual loss when it has occurred up to 6 months time, and the reverse arm is looking from the onset of 7 months to 1 year time. In the reverse arm, they're recruiting 36 patients, so we actively wait for their results. Okay, there's some other National Eye Institute is also supporting one of the trials, which is ongoing. Again, there are 3 different doses being trialed. So there are different organizations working independently, looking at the gene therapies for Leber's. Moving on to choroidermia, we know it's an X-linked disorders, and it affects the RAP gene, which is your RAB escort proteins. The phase 2 results studies is recruiting at the moment. I think they've just finished the recruitment, so we wait for the results. In this, they are looking at the anatomical and functional safety at 12 months time. But again, this is a subretinal injections. Okay. There is another study from the University of Miami. Again, there's a subretinal injections, but they had a confirmed diagnosis of phenotype, and this is the genotype. They have a choroidermia gene. The previous was just looking at the null mutations. I'm coming mostly to the end. Again, some other trials, which is probably called as a STAR trial for choroidermia. UK is one of the centers. They're still recruiting. This X-linked juvenile retinoschisis trial has stopped because the sponsors did not find 6-month results, any benefits on the visual functions. Okay, now a lot of the trials we saw, they were all based on the gene augmentation therapies, but I think so we are getting some positive results. People are not looking at the dominant disorders as well, but just the last slide, that people are now looking at the stem cell regeneration therapies as well. So we'll watch this space, though the Stargardt's trial has stopped because it did not show the benefits, but this is the active trial at the moment, and we look for the results. SOX-COTS2 is what you need to look for. Okay, thank you.